Hello everyone, my name is Chloe Edwards. I'm with Voices for Virginia's Children. I am a staff member on our campaign for a trauma-informed Virginia. And the goal of today is to walk you through our 2020 campaign for Trauma-Informed VA Advocacy Day. And in addition, I want to highlight the process of crafting your talking points for those that will be participating in legislative meetings. So let's start off with an overview of the day. Just a reminder, the Trauma-Informed Care Advocacy Day takes place January 21st, 2020 of this year from 8:30 a.m. to 2 p.m. The location is the University of Richmond downtown. That is located at 626 East Broad Street, Richmond, Virginia. I will send out parking instructions as well. The parking deck is adjacent to U of R downtown. And remember, as you're walking in, we are in the lower level multi-purpose room. Logistics for the day. We will start the day promptly at 8:30 a.m. We are asking that folks get there on time. We will just have 30 minutes before walking down to the General Assembly for meetings that may begin at 9 o'clock or as soon as 9:15. So there will be a light breakfast provided at 8:30. We will have access to the space at 8 a.m. for your early birds who do arrive early. From 8:30 a.m. to 9 a.m., you will be directed to your advocacy group leader. We will travel in groups, so you will meet other group members. If you are speaking, you can run your talking points by your advocacy group leader, and they will be a resource in providing any feedback that you may have or answering any questions. At 9 a.m., we will begin meetings with legislators. That means we will walk from the University of Richmond down to the General Assembly. I will send out instructions for you on getting through security, prohibited items, etc. So stay tuned to your emails for that. 9 a.m. to 11 a.m., you guys can expect to have 2 to 3 meetings with legislators. Again, you do not have to speak. If you just want to stand in silence and show solidarity, this is an option as well. From 11 a.m. to 11:30 a.m., this will be a transitional period and also a break period. So you will transition from the General Assembly back to the University of Richmond downtown. Some of you may have some 11 a.m. meetings. It should end by 11:15 a.m. With this being said, the transitional period will end at 11:30 a.m. At that time, a lunch reception will begin. The point of the lunch reception is to give you all an opportunity to really network and engage with trauma-informed community networks across the state, partners, community members, etc. This will also be an opportunity for us to showcase some of our campaign partners who are not able to participate in the Advocacy Day because they represent public entities. So from 11:30 a.m. to 12 p.m., we will highlight some of our campaign partners who will speak on behalf of how some of the policy impacts the work that they do. Also, their role in the crafting of the policy agenda. From 12 p.m. to 2 p.m., we'll begin an artist showcase. The artists have submitted themes around peace and resiliency. I think this is very fitting as our Advocacy Day follows Martin Luther King Jr. Day. We will also send out some details about that. There are some events that will be taking place on MLK Day. We are closely monitoring these events. We have the best interest of our advocates in mind, and we'll send out details if any of our Advocacy Day plans change as a result of some of the protests that will take place on MLK Day. However, should everything go as planned, our artists highlighting what MLK stood for around peace, resiliency, the component of recovering from cultural and historical trauma is very fitting for this theme of our Advocacy Day. So our artists will showcase pieces around this, including poetry, some readings, music, and etc. At 2 p.m., the event will end. And so this is what you can expect for the day. Let me know if you have any questions. This is also highlighted on our website as well if you want to review all of the details that have gone into these logistics. So on our agenda, I will show an overview of the campaign policy agenda. I will also talk about the political landscape, and then I will begin reviewing agenda talking points with you. I will not highlight all of our policy agenda as it is very robust, but I will highlight some key items that can transcend to other items of the policy agenda if you follow the example. So now I'll begin by talking about Voices for Virginia's Children. If you're not already familiar with our organization, our mission is to champion public policies that improve the lives of Virginia's children, especially in areas of early care and education, family economic security, foster care and adoption, health and well-being, mental health, and trauma-informed care. We looked at all of these disciplines and we thought that all of them were reflective of the disciplines that trauma impacts, and this is what led us to our campaign for a trauma-informed Virginia and the creation of a unified policy agenda around trauma-informed care. We are privately funded. We do not directly benefit from the funding that we advocate on behalf of. We are a nonprofit and nonpartisan. We work with everyone, Republicans, Democrats, Independents, and etc. We're also data informed and home to the Kids Count Data Center, which tracks over 40 indicators of child well-being by locality, over 150 indicators at the state level, and this is funded in partnership with the Annie E. Casey Foundation. Our campaign for a trauma-informed Virginia highlights resources for advocates. Also, an overview of our policy agenda, which you can find if you click the campaign tab and go to Unified Policy Agenda on our website, which is vakids.org. We also provide policy updates and blogs, including Voices from the Capitol emails, which will update you on what is going on in the General Assembly. In the crafting of our policy agenda, we worked with trauma-informed community networks across the state, over 20. We looked for trends and patterns in providing technical assistance and policy analysis around how best practice can meet sustainability. We also strive to use an equity lens to lift policies that promote equitable opportunities, and we are data informed in doing this as well. That led us to our campaign for a trauma-informed Virginia's unified policy agenda. You see it covers disciplines around community level prevention, family-based prevention, early identification and intervention, school-based interventions, better outcomes, and trained and supportive workforce. Again, I'm not going to highlight all of the items on our policy agenda, but you see what each of these themes includes as far as the systems and impacts. And the examples I show can transcend to any discipline that you particularly work in. So in a community level prevention, here you see our talking point sheet. Each of you all will have this on the Trauma Advocacy Day. I'm not going to get into the weeds of the policy, but what I want you to think of is this model that we use is how can you uplift the policy using your story to personalize it or any data to show that there is in fact a need for it. So here you see the request is $750,000 each year to FACT in order to provide grants and technical assistance to community-based networks. So we'll start off with the what, which is to provide funding to support community-based trauma networks. Why is this needed? Well, Family and Children's Trust Fund currently funds the Charlottesville and Greater Richmond Trauma-Informed Community Network. They have funding to fund 6 trauma-informed community networks. However, there are over 20 trauma-informed community networks. So as an advocate, how can I show my legislator that there is a need for this? Well, I'm going to start off with saying, hi, my name is Chloe Edwards. I am a member of the Southside Trauma-Informed Community Network. Back in August, they had this amazing event called Moving Beyond Adverse Childhood Experiences, the Impact of Race, Culture, Poverty on Trauma. This was a great event that got our community together. We learned a lot of best practices in being trauma-informed and developing trauma-informed approaches. The Southside Trauma-Informed Community Network is an essential network in my community and has over 50 members of the network. So I asked you today to support the request for $750,000 each year to the Family and Children's Trust Fund to provide grants and technical assistance to other networks like the Southside Trauma-Informed Community Network, because it makes a great impact in my community in building community resilience and mitigating the impact of trauma. Okay, so that's an example. Let's think of another example. Say you are a member of the Greater Richmond Trauma-Informed Community Network. Hi, my name is Chloe Edwards. I'm a member of the Greater Richmond Trauma-Informed Community Network. It has over 100 organizations a part of the network. I'm a part of the committee for the healthcare systems incorporating trauma-informed practices within healthcare, because we know that trauma has a negative impact when it comes to the social aspects of trauma and health outcomes. And so we want to create resilient children as well as a resilient community. I ask that you support the request $750,000 each year to provide Family and Children's Trust Fund funding in order to provide grants and technical assistance to other networks like mine. Okay? So that's another example. Now, you don't have to be a member of these networks in order to advocate for funding for these networks. You can say, people like me, we want to get involved in these trauma-informed community networks, and we can't do that if they don't exist. So let's make sure that these networks can be sustained by supporting the request for $750,000 each year to FACT, to provide grants and TA to community-based networks. All right, so next, we know a lot of networks are starting off with adverse childhood experience interface training. What is an adverse childhood experience? Well, this could be separation from parents. For a child, it could be the incarceration of a parent. It could be dealing with physical abuse or neglect. So why don't we show an example of how you can use the data to advocate for policies? Hi, my name is Chloe Edwards. 20% of children in Virginia experience one or more adverse childhood experiences, and I used to be one of these children. I'm supportive of continuing the statewide rollout of adverse childhood experience interface training. I'm a part of the Southside Trauma-Informed Community Network, who has used this training themselves. The training is free for community members like me, and I've been able to benefit from it. I ask that you support the request of $500,000 each year to fund this evidence-based training model for professionals, so that other professionals, organizations, agencies, and community members like myself can be trauma-informed when working with children and families. All right, so that's another example. Right, now let's go to family-based prevention. So here, we're promoting economic stability for families. So the ask is promote economic stability for families that have experienced economic hardship and trauma. This talking point also notes that child poverty rate in Virginia has remained unchanged since the 2008 recession, and financial support for families, such as monthly cash assistance provided by TANF, has not kept up with inflation. So how do we mold this talking point to legislators? Well, Hi, my name is Chloe Edwards, and growing up, I experienced a lot of economic hardship, but I benefited from programs like TANF. However, we need to increase funding for TANF to increase the standard of need to determine eligibility and assistance for families so that more people can qualify. So I ask that you support the increase for TANF. It notes on our talking point sheet that we're trying to increase it by 18%. In order for more families to be financially independent and to reduce the economic stress and hardship on families. So, what's another way we can word this? Hi, my name is Chloe Edwards. I'm a triplet, and growing up, we were very dependent on some of the programs that come with TANF when we experienced economic hardship and even went through a housing foreclosure. I'm hoping that other families like mine in this particular predicament that I dealt with in my childhood won't have to face the same economic trauma that I faced. And in order to ensure that, I'm asking that you take advantage of the TANF surplus, increase TANF monthly cash assistance by 18% each year over the next 5 years in order to make more families eligible for TANF. Children thrive in families where they're able to see at least their basic needs met, and that TANF cash assistance program does help with this. Okay, that's another example. And so you can shift the narrative based off of what you've experienced. A lot of us have a lot of experiences, and you can't share all of them in a short meeting, but you can definitely highlight some of those pieces of your story that really do tie to the policy agenda and show the need. So for our ECE, early childhood education advocates, there are a few items in our agenda that we will definitely need some additional advocacy around, and this is one of them, as well as the Trauma Informed Community Network funding and the ACES interface training model, because these are items that are not in the governor's budget. So we really do need advocates to uplift this ask as well. So early identification and intervention, we see a lot of students display an increasingly more behavioral challenges at a young age, which is 0 to 5. So with this being said, we see the early childhood mental health consultation model as a way where we can reduce suspensions and expulsions of students so that students are in school, learning, and thriving. So this is a good example of how we can use that data again. 63% of Virginia preschool teachers identified access to early childhood mental health consultation as a top priority. We ask that you support the 63% by supporting the study resolution to create a statewide consultation model available to children in all public and private early care programs and in every community. We see early childhood mental health consultations as a top priority. So it's another way I can word this well. Say I'm a parent. My child is increasingly suspended in schools over and over again. It's really tough for me as a parent because I am not able to go to work, and as a result, I'm not able to provide for my family. And so I support the early childhood mental health consultation model because we need to be able to recognize symptoms of trauma in children. We need to be able to respond to mental health needs of children. We need to make sure that children are in school learning. And so I ask that you support the request in order to improve the study resolution to create a statewide consultation model available to children in all public and private early care programs and in every community. Because parents, we want our children in school, and I also need to be able to provide for my child by them being in school while I am at work. Please support this ask. Now, for those who work in the schools, we do have an item on our policy agenda around school-based interventions. There is close to $1 billion proposed in funding for schools this year. We know that there will be a fight over this amount of money and what should be prioritized. And so with this being said, what we are supporting is support staff in the schools, and we're also supporting the taking of additional steps to increase access to school-based health centers. So for folks who are in the schools, and if you relate to this policy agenda item, what can we say to legislators to make sure that they're putting the school-based interventions, keeping that in mind? Hi, my name is Chloe Edwards. I'm a counselor who is off today advocating as a constituent. In my personal experience, I've been very passionate about school-based supports and resources because I've witnessed counselors who have had high workloads and not be able to provide that direct counseling and supports that students need because they have too many students or spend too much time on the administrative component of their job. So I'm asking that you prioritize not just the support positions of counselors, but social workers, psychiatrists, psychologists, etc. in the schools in order to meet the needs of students who need that additional support in the school so that they can learn. Now, if you are supporting the school-based access to mental health, here is another thing that you can word this as. Hi, my name is Chloe Edwards. I am a part of the Southside Trauma Informed Community Network. One of the projects coming out of our network is the School-Based Health Center. I see this as an opportunity for students to have access to health care if they are unable to get it elsewhere because of a lack of transportation or something like that. And so I ask that you support school-based health centers in order to make sure children are healthy when in the school so that they can focus on the learning component of school. Okay. Now let's go to another example for our child welfare folks. You may already be familiar with the Families First Prevention Services Act. It shifts our child welfare system to prevention and impacts 3 sectors: substance abuse, mental health, and ECE. So like your home visitors would be an example of that. In order for Families First to be implemented, we must scale up evidence-based services, and all services must be trauma-informed. The language is that a child at imminent risk of entering the foster care system, the families and the child could qualify for services that come out of Families First. So how can I advocate for this support funding? One thing that we are advocating is to create the structure we need in place to improve Virginia's foster care system. So currently on this agenda, we have $33 million over 2 years in the governor's budget to provide evidence-based and trauma-informed mental health, substance use disorder, and in-home parent skill-based training to children at imminent risk of entering the foster care system. Okay? On our trauma agenda specifically, we have, I'll get to this later, stabilizing the foster care workforce. But me as Chloe, hi, my name is Chloe Edwards. When I was 14, I entered the kinship foster care system. However, this possibly could have been prevented with family-based prevention and providing better outcomes for children and families through family preservation. I support the scaling up of the evidence-based services of Families First because my father suffered from substance abuse addiction when I was young, and oftentimes we found him going on drug binges, which also led to incarceration. The services that you're offering here with Families First could have kept my family together and providing the right resources my family needed for my father and also for my mother who was struggling with mental illness. I ask that you support the request for funding of $33 million over 2 years that is in the governor's budget to provide these evidence-based and trauma-informed services that Families First is proposing. And while we're advocating for a trained and supportive workforce for Families First, I wanted to highlight mental health in this webinar in order for our mental health advocates to have an example of something that we're advocating for in this sector. So, the ask is to address behavioral health workforce needs through the creation of a student loan repayment program, specifically for behavioral health providers. This could come out of the community service boards and act as an incentive to address workforce shortage and high staff turnover. So, how can I propose this? Hi, my name is Chloe Edwards. I have a daughter with mental health needs, but we do not have a local clinician in place for her to see because of this shortage. I'm supportive of the student loan repayment program in order to increase the workforce incentives for us to get more professionals in this field in order to serve children like my dear Annie. Instead, we have to travel 30 miles to a different locality, and this takes a lot of time off of work and decreases the finances I have to pay bills, and many times she's not able to get the help that she needs because of this. I hope that you will support the ask for addressing the behavioral health workforce in order for other children to have access to the services that they need. Please support the creation of a student loan repayment program specifically for behavioral health providers. Now, if I was a community service board employee, while I can't advocate as an employee, I can advocate as a constituent. In my professional experience, I've worked at an agency before where we did not have enough staff in order to meet the demands of the needs we have in the behavioral health field. I'm supportive of the student loan repayment program because I'm hoping it will increase the workforce and increase access to services for families and children who are trying to get the help that they need. Please support this student loan repayment program creation. Okay, so I know in this webinar I mentioned a lot about state employees versus other employees. So just so you know, if you're a state employee or represent a public entity, or if you're a local employee, you cannot directly lobby on their time. You can, however, lobby as a constituent. So I see that we do have some public employees RSVP'd for the Advocacy Day. Just keep that in mind, that you cannot advocate in representation of the public entity that you work for, but you can advocate as yourself with some professional experience. Nonprofit employees and citizens or constituents can advocate at any time. However, you must remain neutral and bipartisan or nonpartisan. You can also share your story at any time with us without directly lobbying, especially if it ties to some of our policy agenda items that need some additional advocacy. So now we're going to give you some tips on preparing for your meeting. I'll also highlight some blogs that you can read on our website that really walks you through how to connect with your legislator. But we will be scheduling the meetings for you. Groups that have trends of legislators will likely get their appointment scheduled with their legislator. We do have some outliers, and if you happen to be one of those outliers on Advocacy Day, just please connect with me if you want to make sure you get a meeting sometime before the GA ends with your legislator. We can help you do that as well. So research your legislators' areas of interest, their voting history, their community assignments, their full-time professions. These are all areas that will help you connect with them. Do develop an agenda. Part of why I'm taking you through this webinar is to help you craft those talking points and that specific ask that you want to request with your legislator. Assume you will only have about 10 to 15 minutes or less. During session, it could be 30 seconds. It could be 15 minutes. It could be 5 minutes. You never know what to expect. And you may not get a meeting with your legislator. It could be a legislative aide or an intern. Do know that these are just as effective. We will have some supporting materials for your group leader who will hand that to your legislator. Many times they do ask if you have some materials, and we will have this prepared. So, what are you going to say in your meeting? We've walked through this webinar, and we've mentioned a few things that you can say if you connect to some of these items. I just want to walk you through kind of the agenda. So, you state the purpose, be clear about your position, personalize the issue by telling your story. We'll have constituents in the groups with the legislators, so a constituent could make that issue local and relevant by specifically talking about what's happening in their district. We ask that you be a good listener, but do tactfully bring back the conversation if you see it coming off track. So now we'll practice. So a few years ago, I advocated for the Kinship Guardianship Assistance Program bill. Many I see on our Advocacy Day have signed up and saying that they have some personal experience with what we're advocating for. So something similar to this that's on our policy agenda, and for foster care is creating structure for Virginia's kinship care system. However, at this time when I was advocating for this back in, I want to say it was like 2017, I told my story. So if you're an advocate that has a story, whether it's a professional or a personal story, I'm just going to use this as an example of how you can develop your talking points. So, hi, my name is Chloe Edwards. When I was 14, I entered the kinship foster care system with my grandparents. I'm a triplet, but only 2 of us entered kinship foster care placement with my grandparents because they didn't have the right supports and didn't feel like they could take on all 3 of us. As a result, I was separated from my brother at this age, and that was a very traumatic experience. My grandparents are also retired and live on a fixed income. Things like healthcare access or counseling and etc., which is not always an option because it was too expensive. We did have to pay out of pocket for a lot of healthcare costs because of gaps in insurance, and they didn't have the right supports in place to be trauma informed or any support in navigating the process of taking us on as teenagers. My father was incarcerated at this time, but called my grandparents from jail, and they came to court, and the judge asked, can anyone take these children in? And my grandparents stepped up to the plate. I'm very grateful for it because I've been able to be very successful. My mother had some mental health issues, and when placed with my grandparents, she said she no longer needed her visitation. We didn't want to further strain our relationship, so my grandparents didn't opt to file for child support. However, with my grandparents' love and persistence, I have been able to be successful. I now work for Voices for Virginia's Children. I work on the campaign for a trauma-informed Virginia to advocate for other youth like me. However, and I don't want permanency to be a privilege for other youth. I realize that I've been able to be successful, but not all youth do not have the same access to this opportunity. Permanency shouldn't be a privilege, it should be a basic human right. Today, I'm asking for you to support the creation of structure for Virginia's kinship care system by offering financial supports to relatives like my grandparents. Thank you. So you saw an example of a personal story and a professional story. These are two routes that you can take during the Advocacy Day. And for advocates sharing their personal story on the Advocacy Day, we know that this can be traumatizing for some. And so we're hoping that the latter of the day, the reception and really highlighting resiliency in art, will leave advocates inspired and motivated to continue on with advocacy, because we know that that can be tiring. So there are some other blogs on our website that can help you continue to prepare for Advocacy Day. One is our 2020 Advocacy Days Toolkit, Prepare to Advocate. That's the title. It was created December 12, 2019. You can visit vakids.org and click our blogs to find this. It includes an Advocacy 101 training webinar. It also has our What's in the Governor's Budget webinar. And it's connected to an example of what an Advocacy Day looks like. There's also another blog which is titled How to Connect with Your Legislator, created November 22nd, 2018. This will walk you through those suggestions and the do's and do nots as well. And then, of course, you have me as a resource. So you can always ask me questions. My name is Chloe Edwards. You can email me at Chloe, CHLOE, at vakids.org. And then I also want to highlight that Monday from 2 p.m. to 4 p.m. I will have office hours. I will send out our conference line information in an email, and you can call in to the conference line Monday the 20th, 2 p.m. to 4 p.m., and I will be there as a resource in answering any questions you have, or if you want to go over your talking points, you can do that as well. So thank you everyone for listening in to this webinar. I hope you feel a bit more prepared, and please do not hesitate to reach out to me with any questions that you have.